Everything you need to know about sildenafil. Sildenafil was the first active ingredient discovered for the treatment of erectile dysfunction. Originally, sildenafil was sold exclusively under the brand name Viagra, as the manufacturing company Pfizer held a patent on it. However, in 2012 the patent expired and other pharmaceutical corporations gained authorization to start manufacturing medicines with the same active ingredient. Medicines containing the same active ingredient are so-called generic medications. They are cheaper equivalents of the branded medicine with exactly the same composition and mechanism of action. Remember, sildenafil is a clinically approved generic version of Viagra. How to use sildenafil and what dosages are available. Regardless of the manufacturer, sildenafil is available in 3 different dosages: 25, 50 and 100 milligrams. 50 milligrams is the typical starting dosage, usually recommended to men who use the medicine for the first time. 1 pill should be taken 30 to 60 minutes before intercourse. It is effective for 4 to 5 hours. How does sildenafil work? Some people think that sildenafil causes involuntary or continuous erections. Don't worry, this is not how the medication works. Problems with achieving an erection are most often caused by reduced blood flow to the penis. Sildenafil relaxes smooth muscles and widens the blood vessels inside the penis, which increases the blood flow into the tissue and helps to achieve and maintain an erection. However, this only happens as a result of sexual stimulation. After ejaculation, or when sexual arousal falls, the blood flows out of the penis and the erection stops. Euroclinics, your online doctor and pharmacy.